It's one of our 5 precious senses, our sight. The gift of sight is invaluable and impacts our quality of life. We rely on our vision every day, whether it's enjoying all the fun on the western Colorado monuments, mesas, and trails, spending quality time with family, accomplishing daily tasks like cooking or reading, and even pursuing our passion. At Hoffman Eye Care, we're dedicated to improving and protecting your precious sight. Our knowledgeable team of specialists work hard every day to ensure our patients get the best possible care and results. Dr. J. Hoffman and his team offer a uniquely broad range of surgical treatments in eye care: glaucoma, cornea transplant, eyelids, diabetic eye disease, and cataracts, the most common treatable cause of vision loss. A cataract is a clouding that develops in the natural lens of the eye. A cataract obstructs the passage of light to the eye and can vary in degree from slight to complete opacity. At Hoffman Eye Care, we use the most advanced, widely accepted state-of-the-art techniques. Dr. Hoffman has completed more than 20,000 cataract surgeries, specializing in no-stitch, no-patch implant surgery. Dr. J. Hoffman has been successfully removing cataracts for more than 3 decades. In 2004, he founded Hoffman Eye Care and invested in state-of-the-art equipment and technology to provide our patients the highest quality care and results possible. Dr. Hoffman is helping to bring sight to people around the globe. He's shared his time and talents on missions in Mexico, Iraq, Honduras, Myanmar, and India. Helping people see better is not only his occupation, but his passion and mission in life.
Hi, I'm Dr. J. Hoffman. In this video, we'll take you on a virtual tour of what you will experience at Hoffman Eye Care, from your first exam to your postoperative care. But first, I want to share with you a few stories from my patients who've been given back the gift of sight.
Before I had my cataract surgery, I was really having trouble reading. In church, I'd be holding the hymnal up close, far away, trying to figure out where I could focus. I wasn't nervous at all about this surgery. Actually, it's a very nice experience if you trust Dr. Hoffman. He really makes everything just super smooth and easy.
So the day of my surgery, I was quite nervous about the whole prospect. Of course, I wanted to have this happen. I was excited about getting my eyes fixed, but it's a little imposing to have surgery on your eye. But I can say that just a half hour later, it was done, and I was surprised at how simple it was.
Before I had cataract surgery, I was having blurred vision. It was hard to drive. It's hard to see the keyboard. The vision that I have now, it's almost what I had when I was 20. It was a wonderful experience.
The surgery was so easy. His staff is very friendly and very efficient and wonderful to work with. They really are, and they all care.
Thanks to Dr. Hoffman and his wonderful staff, I now have my sight back and my life back.
At Hoffman Eye Care, we want to make sure this experience is as comfortable and convenient as possible. In the packet you received with this DVD, you will find your patient information paperwork. We ask that you take the time to fill this out completely so we have every detail of your medical history. On the day of your first appointment, a receptionist will greet you and ask you for your completed patient information paperwork, as well as any medical insurance cards, so please be sure to bring them with you. Once your chart is prepared, you will meet with one of our vision technicians for an in-depth eye exam. We will check your vision and measure the prescription of your eyes. We will also measure the front of your eyes to find out if you have any astigmatism, which causes blurry vision.
One or two.
If you have an astigmatism, it can also be treated during cataract surgery to give you the best possible outcome. We will dilate your pupils so Dr. Hoffman can fully examine the structures in the back of your eye. We will also test you for glaucoma. After your eyes are dilated, you will meet with Dr. Hoffman. He will study your eyes and discuss the best possible treatment for you. Once it is determined that you indeed have a cataract that is clouding your vision, you will have to make a very important and informed decision on what lens is best for you.
Deciding which lens is right for you is a once-in-a-lifetime decision. There are 3 lens options you have to choose from. Keep in mind, once a new lens is implanted, the procedure can never be performed again. Depending on the specifics of your eye, your visual needs and budget, we can fit you with a lens that's perfect for your lifestyle. For your convenience, there's also a review of lens options in the packet you recently received from Hoffman Eye Care.
Option 1 is the standard issue lens. This option is for the person who is on a budget or does not mind being dependent on glasses. It provides clear vision, but you will more than likely still need to wear glasses full-time for both near and far vision. If you have astigmatism, a limbal relaxing incision may be needed at an additional cost to correct the astigmatism. This option is covered by most insurances. Option 2 is for people who want to see clearly in the distance without the need for wearing glasses, but don't mind reading glasses. The cataract will be removed and we will implant a high-definition lens or a toric lens. These lenses carry an additional cost, but you will see the difference every day for the rest of your life. Option 3 is for people with an active lifestyle who want maximum freedom from dependence on spectacles. This is your chance to get the vision you always wanted. A multifocal lens is the ultimate in technology and will give you an expanded range for near and distance vision, dramatically reducing the need for glasses. Again, this lens does have an additional cost, but has enormous visual advantages.
I urge you to review all 3 choices and take a closer look at the lens option information sent to you in the Hoffman Eye Care packet. The choice is yours based on your desired vision goal and what you can budget for. Remember, whatever you choose is for life. The operation cannot be repeated.
Now that the lens choice is made, we need to measure and calculate the appropriate lens power. Once the testing is complete and you have discussed your surgical options with Dr. Hoffman and his team, it's time to schedule a surgery date to get you prepared for your newfound gift of sight. On your day of surgery, we will have you meet us at Day Surgery of Grand Junction at 1000 Wellington Avenue. You will need to refrain from eating or drinking any foods or liquids after midnight the day of your surgery. Once you arrive, we will prepare you for your procedure. A nurse will check your blood pressure and heart rhythm and put numbing drops in your eye to prepare it for the procedure. There's no need to worry. It's pain-free. There's usually no needles or shots. If you're nervous, the nurse will offer you some relaxing medicine to calm your nerves. Since there are no strong medicines used, virtually anyone, regardless of medical condition, can have the surgery performed. It's now time to go into the operating room. It's a very relaxed atmosphere. The operation itself takes between 10 and 15 minutes. A nurse will wash your face. A small incision is made at the side of the eye, and the cataract that was blurring your vision is vacuumed out. Once it's removed, your new chosen lens will be implanted where the cataract was. Normally, there aren't any stitches or patches, so the eye can heal naturally with little or no downtime. We relay the operation through TV monitors so your family member or friend can watch in the waiting area. Once the operation is complete, we will offer you something to drink, and we will give you some simple care instructions for when you return home. We ask that you continue to use your eye drops. Immediately after the procedure, you will be able to walk out normally. When you feel ready, you can leave. Just make sure you have someone with you who can safely drive you home. You can return to your normal life almost immediately, but with better vision thanks to your new lens.
Cataract surgery is the safest and most effective procedure in all of medicine. Here at Hoffman Eye Care, we're committed to helping our patients enhance the quality of their life by improving their vision. We've carefully prepared this information to help you better understand what cataracts are and what you can expect as you prepare to have your vision restored. My team and I have an outstanding record of excellence and are committed to providing unparalleled eye care services. I leave you with some words from our wonderful patients who have experienced a restored gift of sight.
As soon as I walked into the office, it was amazing. The staff was so professional and friendly. You know, the first person I met was Dr. Hoffman, the surgeon. You know, typically you wait, and he made me feel at ease. Life now for me is everything I could hope for and more. I can see the world in so many more colors, and I can live my life the way I want to. I can play with my children. I can ride my bike. I can go snowboarding again. I can do the simple things like drive and walk out on a beautiful sunny day and not be in pain.
When you get your sight back, it's like you remember when you had the vision, and I felt like a 20-year-old. My sight was so clear. I told Dr. Hoffman, I said, you know, after the surgery, I went out to the car and I could see perfect. I just was amazed.
Dr. Hoffman just has this competent aura about him, and you just know that he loves what he's doing, and he just gives you so much assurance just in his body positioning, how he talks with you and everything. You know it's all going to be good.
All of a sudden it was over, and I was like, oh my gosh, I'm all done. I could not get over the brilliant color and the brightness of everything, and it really wasn't a difficult procedure at all.
I would say if you're thinking about having this surgery, get it done as soon as possible. Sooner the better, because it can also correct any vision issue. So that's why I no longer need glasses or contacts, because you can just end up with perfect vision and look across the Colorado River and see the cliffs, and it's awesome. I would suggest do it as soon as you can.